Are you confused about why your intimate life feels off? Is it because of erectile dysfunction or low libido? Though they sound similar, they're very different issues. And knowing the difference can change everything. Let's dive deep and clear the confusion once and for all. Chapter 1: Introduction. Welcome. In today's video, we're going to break down two common but often misunderstood men's health issues: erectile dysfunction, ED, and low libido. These terms get tossed around a lot, but they're not the same thing. Understanding the differences will help you identify what you might be facing and how to approach it. Chapter 2: What is erectile dysfunction, ED? Erectile dysfunction means the inability to get or maintain an erection firm enough for sexual intercourse. It's a physical problem linked to blood flow, nerve function, or psychological factors. Common causes include poor blood circulation, diabetes or heart disease, stress and anxiety, minor effects of medication. ED is about the performance aspect. It's the mechanical ability to have an erection. Chapter 3: What is low libido? Low libido means a decreased or absent desire for sex. It's about the interest or drive towards sexual activity, not the ability to perform. Causes of low libido can be checks low, depression or stress, relationship issues. Someone with low libido might still be physically capable of an erection, but just doesn't feel the desire. Chapter 4: Key differences between ED and low libido. Let's break it down. ED, difficulty with erection. You want sex, but your body doesn't cooperate. Low libido, lack of sexual desire. Your body can function, but your mind isn't interested. Sometimes these issues overlap, but they require different approaches to treatment. Chapter 5: How are they diagnosed? Doctors often ask detailed questions about your sexual history, physical health, and emotional state. They might do blood tests to check hormones or other health conditions, physical exams, psychological assessments. Being honest about your symptoms helps guide the right treatment. Chapter 6: Treatment options for ED. Much medications like Viagra or Cialis. Lifestyle changes, exercise, diet. Therapy for stress or anxiety. Hormone replacement if low testosterone. Counseling or couples therapy. Roving lifestyle, Chapter 7. When to see a doctor. If you experience ongoing trouble with erections or a persistent drop in sexual desire affecting your quality of life or relationships, it's time to consult a healthcare professional. Early diagnosis can improve outcomes. Chapter 8: Final thoughts. Remember, ED and low libido are both common and treatable. Understanding what you're dealing with is the first step toward a healthier, happier sex life. Don't be afraid to seek help. You're not alone. Thanks for watching. If this helped clear things up, hit like and subscribe for more health insights.